My name is Judith Persley. I'm a licensed psychotherapist and I specialize in anxiety and trauma. Welcome to this short video about anxiety. We're going to talk about myths and facts associated with anxiety, and we're also going to talk about if you have anxiety, what are some things that you can do to feel better. Anxiety is stressful. No one likes having it, and in this time of COVID, the pandemic, self-quarantine, or if you can't self-quarantine, the stress of going to an essential position or job or having to get health treatment has certainly exacerbated all the stress and anxiety that we're experiencing today. So I hope this video is helpful for you. My intention is to hit key areas so that it is helpful for you today. Here's what we're going to be covering. First, we're going to go over some commonly asked questions, and I'm going to read them. Why do I have anxiety? Where does it come from? Is it my fault I have anxiety? Can I get rid of it? We'll also cover how I can determine if I have anxiety and also look at how it's treated. And finally, we are going to go over some things that you can do today to help you with your anxiety. Let's get started. First set of questions. Why do I have anxiety? Where does it come from? How did I get it? Is it my fault? Can't a person get through it and get rid of it? Well, first of all, I can't stress enough, anxiety is not your fault. This must be the most common myth and misunderstanding that I encounter, and it is probably the most damaging. Anxiety is not a weakness. It's not because you're incompetent, and it certainly isn't because you don't try hard enough. Anxiety is really the fight or flight system kicked up or kicked on when it should not be. Current research points to the messaging system that talks to the fight or flight system being off kilter. Research points to heredity as being the major factor of getting anxiety, or you can get anxiety, or rather it can get triggered on from chaos and a lot of stress or trauma. Anxiety doesn't discriminate. It is experienced by both men and women, people that are wealthy, not wealthy, stay-at-home moms and dads, physicians, engineers. It just doesn't discriminate. It's across all races. And you don't get rid of anxiety, but the good news is if properly treated, we can usually get anxiety down to a very manageable state. Second set of questions. How do I know if I've got anxiety? How do I know I'm not just stressed? Is it normal to feel this way, or isn't it normal? Doesn't everybody feel this? Is this anxiety? Is this not anxiety? Well, in this video, of course, we're not going to diagnose, but I want to cover things that are very common symptoms of anxiety, and obviously it's different for every person. Every person's unique in how they experience anxiety. Let's review some common experiences, some common symptoms. Worry, having a good amount of worry, having an active mind, unable to shut off the thinking or the activity. Difficulty being present, usually because our mind is so active, it's hard to be in the moment because our mind is thinking and very busy. Difficulty feeling light or feeling no pressure. Much of your day, much of your week is spent managing worry and worrisome thoughts. Having fearful thoughts. Worried when the future is unknown. Worrying about things that have happened in the past. Can't quiet the mind at night. Needing distractions to be able to get off what you're thinking. Another important thing about anxiety and anxiety treatment is don't leave it untreated. If you think you do have anxiety, check with your physician, check with a therapist. If you think you have anxiety, there's a good chance you might have anxiety, Either way, stress, worry, anxiety, who cares about the label? If it's cumbersome for you, it's affecting you, affecting your relationships, do talk to your physician or talk to a therapist. If you don't get stress or anxiety addressed properly, there's a very good chance it can lead to a depressed mood. There's also a very good chance it will lead to using unhealthy coping strategies, because the truth is we have to cope with our stress. Unhealthy coping strategies typically have something about them that do work, but they're not good for the long run. Third set of questions: how is anxiety treated? Do I have to take medication? Does medication help? Well, first off, yes, there is effective treatment for anxiety. First, I want to go back to what we said earlier and watch for that stigma of thinking that anxiety is a weakness. I've had many clients not come in for years because they just wanted to try harder, thinking that they could kind of bust through or figure it out. And that is good thinking. And work on your part will be necessary. But I do urge you to get help with a professional to help you with your anxiety. The most foundational treatment for anxiety is working with a licensed therapist who's trained and specialized in anxiety. The length of time that you would work with a therapist for help just varies from person to person. But working with a licensed therapist trained in anxiety will get you concrete tools and strategies. Those concrete tools and strategies you can use for a lifetime. Therapy for anxiety is not talk therapy, but again, it's learning what anxiety is so that you're not blindsided, because knowledge is power, especially with anxiety. And again, concrete tools and strategies so that you know how to work with your anxiety and get it in a manageable place. Let me give you one example that I like to give folks. I had a friend who was very active in baseball, not professionally, but he played frequently. And later in life, he developed quite a sore shoulder. He was a pitcher, no surprise. So at one point, he talked about it with his physician, and his physician says, I'm going to get you into physical therapy. Let's try that. So my friend went to physical therapy. The therapy improved his shoulder pain. It didn't take it all away, but it brought it to a manageable state, and he could deal with the remaining pain or discomfort that was left over. And the tools or the strategies, the exercises rather, that he learned in therapy, he continues to use years and years after his initial couple of months that he spent working with a licensed physical therapist. So it's the same way with anxiety. We can see a licensed therapist, we can get tools and strategies that are effective with anxiety. It can help us feel better. We can use those tools for a lifetime. But you will have to work, just like physical therapy. And then second of all, medication is also a treatment for anxiety, but definitely not for everyone. It is not necessarily recommended for everyone, and not everyone needs medication. One group of medications that help with anxiety actually help with a messaging system that is talking to the fight or flight system. And most of all, medication is best done when it's done in conjunction with therapy, because again, that's where you use the tools and strategies to manage anxiety. The medication typically slows that push, that intensity of anxiety down, so that the work you want to do and the work that you can do is a possibility. So finally, I want to review some things that you can do right now. One is doing regular breathing relaxation exercises. Breathing relaxation exercises help recalibrate the fight or flight system. Anxiety is not compatible with short, shallow breaths, and breathing relaxation exercises are a practice of taking deep breaths in and exhaling very slowly. You can Google breathing relaxation exercises, or I can give you these few instructions. You would get in a comfortable position in a place where there's no distractions. Ideally, you close your eyes, and each breath looks like this. A deep breath in through your nose, and then exhale through your mouth very slowly, and you exhale all the breath in your lungs. And you would do 5 to 7 breaths would constitute a breathing relaxation exercise. You can do 15 or 20 if you want to. The more you do, the more your body is retraining itself. It's developing different neural pathways. It's very scientific, actually. So breathing relaxations are simple. They don't take a lot of time, but they take discipline. I always encourage people to plan it into your day. When am I going to do my breathing relaxation exercises? I also encourage people to start off with 2 a day. And after they get a couple of weeks of being consistent, you could have a rough start. Oh my gosh, I forgot. Oh my gosh, I'm not used to doing this. I got distracted. But once you get 2 in a day, add a 3rd, add as many as you can, do more. But that's kind of a strategy of how to go forward. Next, what you can do is watch and manage, be intentional, be choiceful about what you listen to, what you watch, what you observe, who you talk with, what you talk about, and this includes texting, social media, instant messaging. All of these things around how you engage is important. Speaking of how you engage, also the activities you engage in, what you do, where you spend your time. So the recommendation is to be choiceful, intentional, and careful about what you watch, what you listen to, who you engage with, and what you do. Be mindful that anxiety is a state of stress. You're not burying your head in the sand if you don't listen to the news for a few days, or just do a little recap online or on your phone. Okay? Your body and your emotions are experiencing a lot, and you want to take care of them. Okay? If I had a sprained wrist and someone asked me to play catch, I'm going to say no. It's not going to be good for my wrist. I want to take care of it. I'm not being a wimp, I'm being wise. Same thing with anxiety. Be wise. Take care of yourself. Be good to yourself. You have a condition where if you don't, it will get worse, it will get more aggravated, cause more stress, and there's a domino effect. Okay? So make good choices. Take care of your emotional and physical self. So, to summarize what we covered in this short video, 1 is anxiety is not your fault. Don't shame yourself. Don't shame others. Anxiety as a condition is often associated with heredity or could be triggered by an event or trauma or chaos. Second of all, anxiety can be a variety of symptoms, which we reviewed. If you wonder if you have anxiety, there's a good chance you have anxiety either way. If you have stress, if you're anxious, if you're feeling troubled, do talk to your physician. Do talk to a therapist. Go online, you can do a search and find licensed therapists in your area. Third, there is treatment for anxiety. That's the great news I want to leave you with. It won't get rid of anxiety, but it will absolutely, in most cases, help you manage anxiety. And then things to do now are your breathing relaxation exercises. Make good choices, what you see, what you listen to, who you engage with, what you do. Take good care of yourself. I want to leave you with the thought that anxiety is something that plagues millions of Americans. Some quotes are 40 million Americans. That's like 1 in 5, 1 in 6 people. You are not alone. It's not your fault. Thanks for listening. Be good to yourself.